So we have genomic imprinting here. Genomic imprinting is silencing of gene. 15q1113 deletion is a famous genomic imprinting in which there are two examples, Prader-Willi syndrome and Angelman syndrome. When 15q1113 deletion is from the paternal side, it is Prader-Willi syndrome. When it is from maternal side, it is Angelman syndrome. Angelman syndrome is also known as happy puppet syndrome. The phenotypical presentation of Prader-Willi syndrome is allonal shape eye, that is triangular eye, hypogonadism, small hand and feet. Then there are some differences between Prader-Willi and Angelman. In Prader-Willi, there is severe neonatal hypotonia. Then there is obesity, small hand and feet, and unusual behavior. Then there is mental retardation and short stature. In Angelman syndrome is normal at birth. Subsequently, it develops, then seizures, then mental retardation and ataxia. Then why the Prader-Willi syndrome patients are obese? They are due to increase in ghrelin. So increase in ghrelin, increase in appetite, so they are obese. Treatment is anti-ghrelin therapy. Why they are short in stature? Because there is decrease in growth hormone secretion. Then we have a classic inheritance pattern of Prader-Willi genomic imprinting. Uh, the way to remember is Prader-Willi paternal. So when it comes from father, the the generation is affected. So when it comes from father, affected. When it comes from father, it's affected. When it comes from father, the children are affected. But when it comes from mother, the children became carriers. When it comes from mother, the children became carrier. And for angelmen, as angelmen mothers are angel, so we can remember is it is that when the disease comes from mother, the children are affected, and when the disease come from father, the children are carriers. Then there are some other examples of genomic imprinting. um, Prader-Willi and Angelman. In Prader-Willi and Angelman, only the 70% cases are due to genomic imprinting, and there are other genetic modalities which we will discuss further. Neonatal diabetes mellitus, genomic imprinting, Beckwith-Widman syndrome, Seckle and Temple syndrome, Wang syndrome, and pseudo hypoparathyroidism 1B all come under genomic imprinting. Then, as we have discussed, that Angelman and Prader-Willi syndrome also have other inheritance modalities. So, there is a concept known as uniparental disomy or uniparental bisomy, which we can see in cystic fibrosis, in sickle cell anemia, and also in Prader-Willi and Angelman syndrome. But as we have seen that in case of genomic imprinting, Angelman syndrome was maternal and Prader-Willi was paternal, and exactly opposite happens in the case of disomy. In case of disomy, the Prader-Willi syndrome is maternal disomy, and Angelman syndrome is Prader-Willi syndrome is unimaternal disomy, and Angelman syndrome is unipaternal disomy. 30% cases. So at the end, Prader-Willi syndrome can be 70% paternal inheritance of due to deletion and genomic imprinting, due to 30% due to unimaternal disomy, and some cases may be also due to maternal silencing gene.